Innovation, imagination, wonder. These are just some of the words used to describe Dr. Harvey Passes. Dr. Passes explores interesting people and ideas that will stimulate you. He questions the people who develop, create, and employ novel concepts in business and everyday lives. He especially loves to speak with successful people. How did they do it? How can you do it too? So let's join Dr. Harvey Passes in his quest of wonder and curiosity as we watch Dr. Harvey Passes Presents.
I thought it would be a lot of fun to have a conversation with you about my first love, and that is dentistry. And you can see the way I'm dressed. And I'm wearing my scrubs right now because I want to share with you lots of information about dentistry, and this show is going to be jam-packed full of it. First, let me share this with you. One day on a Friday night, I'm getting ready to leave my office, and the phone rings. Staff is gone for the day, and I pick up the phone, thinking maybe it's a patient who's having a problem. And it turns out there's a lady on the phone who's been trying to reach me all week, and I couldn't understand what was going on. And for some reason, I thought she might have been a salesperson trying to sell something to me, and I just wasn't interested in that. However, it turns out I was totally off base. This lady is explaining that she represents a company that makes gum, of all things, and that the American Dental Association has just given this company approval, acceptance, if you will, to market this gum because it does something that no other gum has ever been shown to do before, and that is to reduce cavities and reduce decay. And I thought this was pretty interesting. And she said they were looking to get the message out during Children's Dental Health Month about what's going on, and they wanted to have a singing dentist to go around the country and to be speaking and singing all about this to schools or to different kind of television and radio outlets, etc. And I agreed to do it. I thought it would be a fun thing, especially to get the information out about what's going on with our kids and why Children's Dental Health Month, which is a program started by the American Dental Association, which is designed to help kids who are indigent throughout the United States. So I figured, okay, I'd get involved. And it was a lot of fun. And then what I've done was to take this song that I've created and bring it to local schools and to, well, let me explain what happens. I would go to a local school and I would sing the song. And the song has all the words that the child needs to learn about how to take care of their teeth. And then I take the kids and I tell them at the end of the song, I'm going to give you a test. I'm going to ask you if you know the answers to the questions, and the answers are in the song, then you'll get a goodie bag. And in the goodie bag would be toothpaste, toothbrush, and some of that gum, and coloring books, and other interesting things, especially something called tooth prints, to help identify a child if, God forbid, the child is ever kidnapped. A lot of great things in this little goodie bag that we were giving away. So it worked out really well. So I thought it would be a lot of fun right now for you to watch this and see exactly what's been going on. And then after this video clip is shown, we'll come on back and we'll talk some more about it, and then I'll pass on some more interesting information to you. So catch this right now, and me as the singing dentist, and let's roll it and see it.
Never gone to a singing dentist before.
First, I want to ask you kids a question. You ready?
Yeah.
Okay. Who wants to have fun? Who wants to learn while they're having fun? And last, who wants to go home with a present while they're having fun and learning? I am going to sing a song. You all are going to have to listen to the song. But you got to listen hard to the words. Then I'm going to ask you questions. The answers to the questions will be in the song that I've already all in the song. Right you are. So here we go. Let's give our kids a smile. Let's give our kids a smile. Without teeth there can be no chewing. Without chewing there's no nourishment. nourishment. Without nourishment, there's no health. Without health, what have you got? What have you got? It's a dentist's job to tell you all the things you need to know. Brushing, flossing, fluoride rinses, and a checkup twice a year, twice a year. Now we've got something you should be doing all year through. A delight and a treat, something that just can't be beat. Helping to prevent decay, washing the germs away. Brush your teeth 2 times a day, 2 minutes each to fight decay. So, let's give our kids a smile. Let's give our kids, give them a smile. Yay! Okay, now, here's what we're going to do. 2 times a day, do you brush your teeth? Yes! 2 times! Who else said 2 times? Now we've got something you should be doing all year through. A delight and a treat, something that just can't be beat. Helping to prevent decay, washing the germs away. Brush your teeth 2 times a day, 2 minutes each to fight decay. So, let's give our kids a smile. Let's give our kids, give them a smile. I had such a great time doing that. I love doing that. And the kids are so wonderful. I can't think of a better thing to do. So, in doing this not-for-profit venture, I figured it would be a lot of fun. So to bring this to any school, any organization. Now, it's not just for kids. It's for adults as well. So if you know of any school or any youth center or adult center where they might be interested in having a program presented so that people could learn more about good oral health care, just give me a call. I'm happy to have you do that. The number will be on at the end of the show. And this way we can put together this wonderful, as I said, not-for-profit venture out so that the public could see and could learn. And it's been just terribly exciting. It's what could be better than helping people, especially when I see the look on the kids' faces and they're all excited about it. You know, learning is wonderful when you can make it fun. And I know that, you know, if you happen to be a teacher, you know that. Because otherwise it's dry and it's difficult. So putting all of this interesting information, this necessary information to music makes the kids get really excited and the adults too. It's just a lot of fun. So I hope you enjoyed that part. And now we're going to move on to something a little different. You know, you hear today about blogging. Everyone's got their own blog site. Well, we're going to have my own little blog right now here. And what I like to do is, in the course of my reading in my journals that I read about in dentistry, I come across things of lots of interesting information that I thought that once in a while I would present a show like this, just me and you, so that I can discuss with you about what's going on. Listen to this. You're going to get a load out of this. This is great. This is just fantastic. Can you imagine if you have disadvantaged kids who can't make use of, say, orthodontic treatment, and they need it, but they're just too far away from any orthodontist, let's say. Maybe the nearest orthodontist could be, say, 500 miles away, or maybe they just don't have the money to afford it, and it's a big distance away, but they do have a general dentist. Well, this is fascinating. A study was done at a public health clinic in Seattle, Washington, where they were able to take a general dentist far removed from the orthodontist who puts braces on teeth to straighten the teeth. And what happened was they would go ahead and they would use teledentistry. The teledentistry was a very interesting concept. What happened was this. They would use the computer and the internet, and the information and the models of what the children's mouth would look like would be sent over to the orthodontist very far removed from the dentist, the general dentist. And then the orthodontist would explain to the general dentist how you've got to take care of the teeth for straightening purposes, for orthodontic purposes. And they went through all of this, and the study showed, fascinating, listen to this, the results of this study suggest that early orthodontic treatment provided by a sufficiently trained general dentist and supervised remotely by an orthodontist, who's a specialist again in straightening teeth, via teleconference is a viable approach to reducing the severity of bad occlusion in populations of disadvantaged children when referral to an orthodontist just is not feasible. I thought this was fantastic. So more and more we're seeing how the internet helps all of us so we can get good care to people. Check this out. Here's something else that's interesting. And I have to give Congresswoman Carolyn McCarthy kudos for this. And listen to this. She is helping to push a bill through in Congress where facial trauma, any kind of injury to the face, she's discovered is too frequent an occurrence in contact sports. And this can go from anywhere from cycling to volleyball and on and on and on. And what she wants to do is raise awareness of this issue by creating this bill. And she explains that about 5 million teeth are knocked out each year due to these sports activities with athletes participating in these contact sports. And these athletes have a 10% chance of sustaining significant orofacial trauma, and they're 60 times more likely to sustain damage to the teeth as opposed to when not wearing anything protective, like a protective mouth guard. So basically, what she wants to do is have a bill go through Congress so that money would be given for greater education and to get kids or other school-age athletes into the dental office where they could have protective measures made and created for them. Again, my hat's off to her. I think that's great. I see it in my practice all the time. So that happens. Here's something else that's really good that you've got to check on. Listen to this. Some of you might know this, and some of you might not know it, but you got to know it now, and that is new guidelines have been set forth from the American Heart Association. If you have a heart murmur and you have mitral valve prolapse, I'm sure your dentist, when he's discovered this, your dentist has said to you, you know, you have to be treated with antibiotics before your dental treatment. If not, there's a potential for you to develop a condition called subacute bacterial endocarditis. That is a potentially life-threatening disease of the heart which can kill you and put you in the hospital. Well, for years, we've been giving the patients antibiotics. Guess what? Like everything else, things change. The American Heart did a study, the American Heart Association, and they did a study, and basically what they said was that you had a greater chance of having a problem from taking the antibiotics than you did in just not taking the antibiotics and risking the chance of catching any kind of illness by not taking the pills. So here's what they're saying now. They're saying that the guidelines say that patients who have taken prophylactic antibiotics routinely in the past but no longer need them include people with mitral valve prolapse, if you've had rheumatic heart disease, bicuspid valve disease, calcified aortic stenosis, any congenital heart conditions such as ventricular septal defects, atrial septal defects, and hypertrophic cardiomyopathies. So if you've had any of those, according to American Heart, you don't have to be premedicated anymore. However, people who still have to do it are people who do have artificial heart valves, any history of infective endocarditis, and certain serious congenital birth defects, including unrepaired or incompletely repaired congenital heart disease, heart shunts, and other kind of congenital defects. So, or even if you've had a transplant that develops a problem in a heart valve. So in those cases, then you would still have to stay on your antibiotic regime. I would say discuss it with your dentist as well as discussing it with your physician. But it's important for you to know that for the bulk of us, you don't have to stay on the antibiotics anymore. Please speak to your dentist about it before you go ahead and do anything. So let's move on now, and we're going to see something. Oh, this is great. Get a load of this. There is a very quiet kind of insidious disease of the mouth, which when you know you have it, it's just too late. Listen to this. There's something called tooth erosion. Tooth erosion. How do you know if you've got it? You've got sensitivity of the teeth. When you look at the gums, around the gum line or around the area lower down on the teeth, there seems to be a smooth area there that almost looks like glass. And if it's touched, boy, it gives you such a chill right down to your bones. And it hurts. And it brings on a lot of sensitivity. There are many things causing it, but here's a biggie, boys and girls. Here's a biggie. You're going to love this one. Tooth erosion, according to this study, shows it's caused by popular energy drinks. Oh, God. For more than 10 years, energy drinks in the United States have been on the rise. Did you know that by the year 2010, these energy drinks will be bringing in as much as $10 billion, with a B, $10 billion to the companies that are doing this? Well, it's great for the companies, but it's not so good if you're the one drinking this stuff. Let me tell you why. Scientific studies have shown that there is a pH, that's the acid levels in these beverages, such as soda, could lead to tooth erosion, which is the breakdown of tooth structure caused by the effect of acid on the teeth that leads to decay. The studies reveal that whether you drink diet or regular soda, iced tea or root beer, the acid level in these popular beverages that you drink every day contributes to the erosion of enamel. And it has to do with the beverage's buffering capacity or the ability to neutralize the acid. And this plays a significant role in the cause of dental erosion. So these high energy drinks, let me tell you, they've got some bad effects, because I see patients who come into the office with these eroded areas in their mouth, and it's just not a good thing. Wear away your teeth and make tremendous sensitivity. And the cost of fixing this is expensive. It's expensive. Better just drink other things other than all this soda. You know, the best thing of all is just drink some good old-fashioned chilled water. That's what I use. Okay, so that's one thing. Oh, here's a neat little tip that they give you. If you're going to drink these things, use a straw and put the straw back of your throat, not in your throat naturally, but around the back of your palate. Keep it away from your teeth so that the beverage doesn't pass through your teeth. And then rinse your mouth with water after drinking these acid beverages, and limit the intake of soda, any sports drinks, or any of these other energy drinks. Listen, I'm telling you, you'll save money and you'll save your teeth. It'll be really good. Let's move on now. Here's something good that came from the Pennsylvania Dental Association, and they stress the importance of early detection for oral cancer. Yeah, there is such thing as oral cancer, and it's a biggie. Oral cancer is terrible. Did you know that there's about 35,000 Americans every year that are diagnosed with oral cancer, and nearly 8,000 of these people die? And the treatment for prostate cancer, the treatment for colon cancer, the treatment for breast cancer, and I can go on, lymphoma, all of these treatments over the past 50 years, 40 years, 30 years, 20 years have evolved to really help people out. Now, what's happened in oral cancer? We haven't had such good luck. You know, treatment is still kind of rough and tough and difficult, and it really behooves you, I like that word, it behooves you to do what you can to make sure that you don't fit into that circumstance. Early detection is important, so what can you do about it? First, when you go to your dentist, make sure that your dentist does an oral cancer screening. Every dentist is trained to know how to do this. Just say, hey, doc, give me an oral cancer screening. Take a look in my mouth. It's painless. You feel nothing, and it's simply basically good observation and feeling on the dentist's part. And these cancers where the dentist is going to look, they can be in any part of your mouth, including the lips, the gum tissue, the tongue, the soft and hard palate, or in the back, the pharynx, and the top of your throat. Adults over the age of 40 are more susceptible to oral cancer, and this disease historically affects twice as many men than women for some reason. And if you're under 40, please stop smoking. And for God's sakes, don't use any of these chewing tobaccos. That is absolutely the worst. that is horrible. And it's a quiet kind of cancer. You don't know you have it until it's too late. Now they found out also that if you smoke or use chewing tobacco, or even a pipe and cigars, don't be fooled by cigars. That'll cause cancer, and certainly cigarettes will. But if you couple that with the drinking of alcohol on a steady basis, boom, your chances of developing cancer, oral cancer, just go right through the roof. You really increase them terribly so. Also, don't think, if you're watching me now and you say, well, I got dentures in my mouth, what does it matter to me? Ill-fitting dentures, loose dentures, can irritate and possibly bring about pre-cancerous lesions in the mouth, which could eventually turn into cancer. If you've got a loose denture, go to your dentist and say, I need my dentures relined. They flow in material. It's easy to do. They flow in material and makes the denture now become rock hard, fitting in your mouth properly, and doesn't keep wiggling and rubbing against your gum tissue. You don't want that. Also, periodically, once a month, once every other month, take a look in the mirror. Look at your gums, look at your mouth as best as you can. I know it's tough to do. And run your fingers around your mouth. If you feel any bumps, give your dentist a call. Your dentist is trained to help you and to make sure that you get the proper referral to take care of this. So, avoid tobacco and alcohol use, which is what I said earlier. Visit the dentist every 6 months for a regular checkup and get your cancer screenings as part of that twice-a-year checkup. Also, when you go out into the sun, wear a lip balm. It's very important. Lip balm today will have a sunblock, and you want to have that in there also because you can get cancer of the lips very easily. Lastly, eat nutritious foods. Studies show that a diet high in fruits and vegetables can also help prevent potentially cancerous lesions. You don't want that. Listen, this is very important stuff. Here's something else that's very, very, very cool and very, very, very interesting. This is something which really blew me away. Fewer cavities were found, this is in another study, in overweight kids than in kids who are either underweight or average weight. And overweight kids had less cavities. And the study that was shown, they don't even understand why. It says over here that surprised researchers at the Eastman Dental Center, which is a very well-respected dental research center, they analyzed nearly 18,000 kids. And the study found no differences in rates of decay among children ages of 2 to 5 in all weight ranges, while children in ages 6 to 18 who were considered overweight or at risk for becoming overweight showed a decreased risk of decay compared to their normal weight peers. So that's between 6 and 18, overweight kids did much better. They can't understand. They expected to find more disease in the overweight kids, and they didn't. They're not quite sure why. They're not quite sure if they're eating foods higher in fat rather than cavity-causing sugars. Because remember, it's sugar that brings on the cavity, not eating a piece of fat. Are their diets similar to normal weights but lead a more sedentary lifestyle? They really just don't know what the reason is. But you know what? I'll get back to you, and I'll let you know. Here's something else that you're going to get a kick out of. If you're a younger guy, listen up. Bad teeth pose a heart disease risk to younger men, a study will show. The study was done at Boston University, and researchers show conclusively that gum disease, periodontal disease, is a risk factor in coronary heart disease in men less than 60 years of age. And they published this in the American Heart Association's magazine. This is the first study to find a significant association between chronic gum disease and the risk of heart disease. And that's even after adjusting for other factors which could cause heart disease. So, well, check this out. Researchers took into account factors including age, body mass index, smoking, alcohol intake, cholesterol, and blood pressure in 1,203 men at the Veterans Administration Normative Aging and Dental Longitudinal Studies. Say that 3 times fast. The men received the comprehensive medical and dental exams every 3 years for up to 35 years. So they really followed these people for a long time. And it turns out, don't take care of your gums, don't take care of your teeth, and there's a very good potential that you're going to wind up with heart disease. and you don't want that coming to you. Hey, this is really interesting. This is in Norway. The Norwegian Tooth Bank is requesting that milk teeth from 100,000 children in Norway and could become the biggest tooth bank in the world. You got to say to yourself, why are they saving teeth in a little tooth bank? Well, listen up. This is really very interesting. They said that milk teeth can give unique information about environmental influences and nutrition in the fetus and in early childhood. You know, a lot of the foods that we eat, you know, there's things called, I think, strontium-90 and other substances, even pollutants that get into the food. And it winds up going into the fetus while the baby's developing, and then those materials, they stay within the teeth. And when the baby teeth come out, these researchers can check out and see what's in it, where the child lived, and to see what environmental hazards exist. I think this is just fantastic. This is just an amazing thing. Milk teeth can give important information on the cause of diseases and therefore how disease can be prevented. Let me see if there's something else to tell you here. Oh, this is cool. Milk teeth develop in the fetus in early childhood. Substances are built into tooth tissue during tooth development will mostly remain there. Milk teeth therefore act as a black box, recording of what the mother and child have been exposed to. These teeth have almost unlimited durability if they are stored dry, so that the tooth's value will remain for future research. I think this is amazing. By the way, the people's names and all that are kept anonymous, and it only exists by barcode, so that if they need to be contacted for something, then they certainly would be contacted. I got so much to tell you. Do we have a lot of time left at this show? Just a little bit left. Okay, yeah, let me see what's interesting. I got so much. Oh, this is great. I got to make this quick. Get a load of this. In my office one day, I get a letter from the State Dental Association telling me that by such and such date, I have to have a contraption put into the water line in my office so that when patients rinse out and whatever stuff they've got, there could be some mercury from the dental fillings that wash out naturally, and there's got to be a little catch that grabs it. They call it an amalgam catch, and it catches mercury because it's probably the most hazardous material known to man. And they want to catch it, and then someone's got to come by and pick up this material and bring it over to a hazard waste center. Okay, all right, fine. I'll go along with that. That same day, I see from the American Dental Association telling me that their studies show that there's nothing wrong with putting mercury in people's teeth. Now, what's going on here? I mean, on one hand, they're telling me you better catch this stuff when they spit it out, and then you got to put it in a special hazard material box. On the other hand, they're telling you you can put this stuff in. These things drive me crazy. You don't know what to do. Anyway, and there's more research here explaining about all this stuff, neurotoxic mercury waste, and what should be done with all of this. I got a lot more to tell you. Look, we'll do this again next month, and I'll do another one of my, television blogs. Right now, Dr. Pass is saying, thanks very much for taking the time to watch. I hope you enjoyed it. And look, let's take care of our kids. Let's take care of ourselves. Let's do the right thing. If you want more information, you can look at the phone number at the end of the show, or you can check out thesingingdentist.com or Dr. Passes Presents to learn more about dentistry. Okay, until then, we'll see you again next time. Take care.